bald men at greater risk of severe coronavirus symptoms. Researchers at Brown University in the US have determined that androgens, the hormones that cause baldness in men, are linked to severe cases of COVID-19. More men, specifically those who are bald, have reportedly been experiencing more severe cases of COVID-19. The researchers proposed that the link between androgens and COVID-19 be named the Gabrin Sign after Dr. Frank Gabrin, a bald man and the first US physician to pass away due to COVID-19 in the US. Dr. Carlos Wambia, the lead author of the study, said he and his team believe androgens or male hormones are definitely the gateway for the virus to enter the cells, and that baldness is a perfect predictor of severity. The researchers came to this conclusion after conducting 2 studies in Spain. The first study, published in April in the Journal of Cosmetic Dermatology, found that 71% of 41 coronavirus patients in Spain were bald. The second study, published in late May in the American Academy of Dermatology, found that 79% of 122 COVID-19 male patients in 3 Madrid hospitals were bald. In the second study, the researchers proposed observing female COVID-19 patients with severe symptoms and increased androgens. They said this would include females with metabolic syndrome or whom are using birth control methods with progesterone hormones that bind to androgen receptor. Other medical conditions have also been known to cause an increase in androgen activity in females. The researchers suggest this may cause them to be more vulnerable to COVID-19. Wambia and his colleagues believe a vaccine for SARS-CoV-2 is necessary, but androgen suppression as a prophylactic treatment could reduce COVID-19 disease burden. Scientists have been studying the link between COVID-19 and different medical conditions, even blood type. According to The Telegraph, a study recently published on the preprint server medRxiv found that people with blood type A may be more susceptible to COVID-19. The researchers determined that 2 points in the human genome, including one that dictates blood type, are linked to an increased risk of respiratory failure in COVID-19 patients. COVID-19 patients with blood type A were 50% more likely to require oxygen or a ventilator. Andre Frank, the lead author of the study, clarified that the researchers are not sure if the blood group or the genetic marker is the risk.